Well, there is back pain after a hard day's work in the yard, and then there's back pain that shows up no matter what you do. So how do you know when it's time to see the doctor? Dr. Vikas Garg with the Pain Center has the symptoms and solutions for the most common of back problems. Thank you for being here. I want to differentiate serious back pain and just everyday pain. When does that back pain really become serious? What are the signs?
It becomes serious when pain is radiating down the legs, when it's affecting your quality of life, which means it's affecting your sleep. A lot of patients don't know it can affect your organ system, like affecting your heart, your blood pressure, those kind of things. It's a serious if it's a bladder or bowel incontinence, or there's a weakness of the legs.
So pain can cause all of those things?
Can cause this.
But I think sleep would be an easy indicator for somebody to gauge if it's become serious.
Yes, it does.
Are there any treatments that individuals can try at home before they see a specialist?
Yes, a lot of back pain problems tend to resolve itself. And the few things which can be done at home can be physical therapy, stretching exercises, proper body ergonomics or posture, lifting heavy stuff properly. But said so, the serious pain should not be ignored.
I have a family friend who swears by stretching every morning to kind of work out the back. That can help.
Yes, and yoga can help, of course.
And at what point then do you see a specialist? At what point after you've tried the stretching and the at-home treatments, it's just not working for you? When's that line that you've crossed it, you need to see someone professional?
If it's a serious pain, like weakness in the legs, bladder bowel incontinence, if pain is lingering on for more than 2 to 3 weeks, if pain is after the trauma or an accident, research has shown that outcomes are better if pain is treated early on. So when it's affecting your quality of life, like sleep or mood, it's time to see a pain specialist.
But that's a great reminder. You don't want to wait. You want to treat it as soon as possible.
Right. I'm sorry, a lot of research has shown, again, treating pain early on tend to help better.
I think that's a good reminder for everyone who experienced that pain. Tell me, what are the most common reasons, the most common causes of back pain that you see from patients in your office?
We see the most common being the trauma, like auto accidents or whiplash injury. We see normal wear and tear, like degeneration. We see pain coming from heavy lifting. All of these can cause underlying disc, nerve, or the joint problems.
And then, Dr. Garg, what are the treatment options that you have? What are some options that you present to patients that they find relief from?
These days, using a multidisciplinary approach, which includes like a multifactorial approach, physical therapy, sometimes psychological assessment, medications, and the most significant being the interventional or injections, like epidural injections, nerve blocks, facet joint injections is the way to go. Our aim is today, these days, is not only to help with pain, but to help with healing process also.
Getting that long-term relief.
Long-term, that's right.
And getting their life back, really. I know back pain can be so debilitating for some people.
A lot of patients think that it's just a pain cover-up, but research has shown that that's not true. A research done by spine surgeons at Washington University showed that 75% of patients who had injections decided not to have surgery done because injections help them significantly manage their pain.
And we were chatting to the commercial break. You said that's your goal, is to prevent the surgery from happening.
That is correct. That is correct. And all the injections these days are done under X-ray machine called fluoroscope, so that we can see exactly where we are going.
It's nice to know the options.
Thank you very much. Thank you.
So viewers can link over. Thank you.
Thank you very much.